Back, everybody. There's the information. You want to give us a call here and ask questions about your dental situation. 613-789-6559, extension 2803. Email us, Facebook us. We're with Deschenes Poitras Dental Centre, talking about replacing teeth today and anything to do with dental. So we've got our first question. Here's Jen, sent in via email. And this is a good question. My 7-year-old son's teeth are very close together. Is this something we should be concerned with as he gets his adult teeth? So I would say that's unusual. Michael, is that fair?
No, it's actually more common than what you think. A lot of people have a lack of space for their teeth coming in. The main thing we got to look at is, are the teeth going to come in naturally? We try to get around that age, 6, 7, 8 years of age, we're getting the 4 front teeth coming in and on the top and the bottom. Those 4 teeth, we try to get them in. If they get trapped, and they're not able to come in because there's too much crowding, there's not enough space for them to come in, well then we start to act. But usually we wait for the adult molars back here to grow behind the baby teeth. Okay. It's not a baby mouth, obviously, but those molars, we want them in, and then we could start widening the palate, widening,
early intervention, but we need the forefront one, upper and lower, and the first molar.
Same idea, I guess. If they were too far apart, you would work on that as certain.
Generally, too far apart, we leave them be.
Oh, do you?
Until they're later? 11 or 12, because more space, usually a little bit easier than less space.
Gotcha.
Usually, though.
Gotcha. All right. Okay. We have a second question that just came in via Facebook, I believe. Here we go. Here's Florence. My 8-year-old daughter is getting her adult teeth slowly, and they're coming out very crooked. Is there anything we can do now, or do we need to wait until they're all out and eventually get braces when she's a teenager?
It's a similar answer. If they're coming in very crooked and very not at the right spot because there's a lack of space, well then you try to create some space early. Then we put braces on later on most cases like that with a little bit of turned teeth, etc. If all the teeth come in, generally no intervention. If it's affecting the bite where they're hitting those teeth traumatically and they're not able to get their teeth together properly, well then we have to act earlier.
There are 2 phases. The first phase is to create the space with some kind of appliance. Right. And then so we create the space, we wait for the adult teeth to come in, then we put braces later on. It depends on the specialist who's doing the ortho. Some will prefer weights. Some other will say, no, let's work on the bone base.
And it's case by case.
And it's case by case.
In this case, in many cases when it comes to dentistry, everything's individual, right? Because everybody's different. Every situation is different.
And it's hard to, when you see just the tip of the tooth, you see it's crooked. A lot of times they'll straighten themselves out, surprisingly enough.
And in the end they might.
And the other thing is that you can't move teeth that are not in the mouth.
True. Good point. It's impossible.
You can't move them.
Let's talk more about replacing teeth, because you brought along some good examples of this now.
The second option is the bridge. Right. Where you're missing that tooth. We talked about implant earlier, but we can also work with the 2 teeth beside, and we kind of shape them a little bit. We try to keep much as we can natural structure, and then we take an impression of it, and we end up with this.
Not that big though.
Yeah, not that. 2 crowns and a kind of a, people like usually say fake tooth in the middle. Yeah. We call it a pontic, and then we cement it that way.
So this tooth might be missing or damaged, right? These 2 are healthy. Is that?
See, that's
where you have an issue with it, right?
Yes.
Because so you're taking 2 healthy teeth and you're manipulating them when there's nothing wrong with them.
If there's something wrong with it, there's large filling, broken the 2 neighboring teeth, well then these will strengthen them.
A bridge would strengthen them?
Exactly. But I agree with you. If there's nothing wrong with these 2 teeth,
why do you want to damage them?
I cry doing this. I find it's horrible.
Well, we usually refuse. We say no,
you should
only
get an implant.
Yeah. But
the problem is, though, and we were talking about this in the break, the problem is a bridge like this, some of it's covered, right? Yeah. Whereas an implant is not.
So that's,
what sense does that make?
That's the dilemma we have. Because some people, they have perfect teeth right there, and they're missing one, and we say, no, you have to have implants. And they say, well, it's not covered as the bridge is, so can you do the bridge?
Right.
And that's where we have to say...
This is where we should talk to insurance companies. I hope they're listening right now.
Yeah.
And that they
because
cover it.
Let's use my case, for example. There's no way you would want to do my front tooth here and the other one right here.
Healthy. Why would you touch them?
Yeah.
So...
Well, there's alternatives. For a front tooth, you could do what's called a Maryland bridge, which is basically wings that go onto the two other teeth. So I'll show you what that looks like. It's a Maryland bridge. There's wings that go behind these two teeth and supports one tooth.
But now the wings are white now. We can design it like much more aesthetic, because the issue we had in the past was we could see kind of a grayish shadow behind the teeth.
Yeah.
But now we can avoid that.
But I keep hearing that but in your voice. An implant is the best way to go.
It's the best way to go. When we use bridge, we usually solve more than one problem, like deep decay or damaged teeth and an empty space. Yeah. So we say, there we go, that's worth it. Okay. Other than that...
Yeah, I get what you're saying. Yeah. I understand. Hey, if you listen, one more opportunity to ask questions today. It doesn't have to be about implants and bridges and replacement teeth, but if you do have an issue with that, it's a perfect opportunity to ask those questions. 613-789-6559, extension 2803. Email us, Facebook us questions. If you want to get a hold of our friends here from Deschenes Poitras at the Dental Centre, they're in Stittsville on Main Street. There's the phone number. And there is their website. So make sure you drop by the website or give them a call and set something up, because if anything, a consultation about replacing teeth is one of the most important things you can do, right? All right, we'll take a break and be back with more of Ask the Expert right after this.